Hello, and welcome to this general introduction to Barnet Primary Care, delivered as part of the induction program from Barnet Training Hub. My name is Will Mayer. I'm a GP at PHGH in Barnet, PCN 6, and I'm also a GP Fellow with the Training Hub running the induction program. The plan for this talk is to give you a general overview of primary care in Barnet, to complement the information in the induction pack, which you can download from our Training Hub website. So as part of the introduction to Barnet Primary Care, I'm going to talk about the different organisations in Barnet that you will come across. The Training Hub is responsible for supporting the primary care workforce. The patient is the centre of everything we do, and we have a community focus where we believe that a well-supported workforce delivers good patient care. And that's part of the purpose of this induction programme, is to help you settle into your new role in Barnet. Now, the CCG is the Clinical Commissioning Group, and previously there was a different CCG for each borough, so we were part of Barnet CCG. Then in April 2020, Barnet CCG formed with the 4 other boroughs in north central London, Camden, Islington, Enfield and Haringey, to form NCL CCG. Now, the CCG is responsible for the funding of community and hospital services. In other words, the CCG is the commissioner and determines which services it will pay for in order to provide holistic care for all of the patients in north central London, whereas the hospitals and community providers are responsible for delivering those services. Now, there are some significant changes planned in the organisation of primary care, and CCGs will soon become integrated care systems, or ICS. You may have also heard of integrated care partnerships, or ICPs. Now, these are a new model of providing joined up health and social care that involves closer collaboration between commissioners, providers, other local NHS organisations, local authorities, and other groups such as charities and community groups, in order to deliver the main aims of the NHS long-term plan. These are to keep the local population as independent as possible, by supporting residents in self-care and focusing on prevention and health promotion. A key target or a key aim is to reduce the number of unnecessary hospital referrals and avoidable admissions, and to reduce A&E attendances, by providing care closer to home, and addressing wider determinants of health, such as employment, housing and education, in order to improve overall health outcomes. A key stated aim of the ICS is also to ensure that the workforce is fit for the future through joint workforce strategies, and so training hubs will continue to deliver this support. The Federation is a group of GP practices which pool their resources in order to provide certain services that are more efficiently delivered at scale. For example, extended access services, the pharmacy-led anticoagulation service, and the Diabetes Quality Improvement Service team. And the Federation works closely with the Training Hub. PCNs are also groups of GP practices on a smaller scale than the Federation, and PCNs receive funding to provide additional workforce and services, again, that are more efficiently delivered as a partnership between practices. So, for example, we have PCN pharmacists who work across multiple practices within a PCN, because it's not cost effective for very small practices to employ a full-time pharmacist. So by sharing, it's much more cost effective. This map shows how Barnet is broken down into its constituent PCNs. And what this shows you really is how different each PCN is, not just the geographical size, but also the patient population and the makeup of that population. And by breaking up the borough into PCNs, each PCN can provide services more efficiently according to the specific needs of their population. So as an example, PCN 3, which is the largest PCN you can see on this map, has a much bigger population than the other PCNs, and in particular has a much higher number of care homes than the rest of the population, and therefore their needs will be very different to some of the other PECNs. I mentioned also about the providers who are responsible for delivering the services, should they be awarded contracts by the commissioners. And there are a range of providers across NCL, ranging from community hospitals to large secondary care hospitals with A&E departments. Tertiary services are also commissioned by NCL, for example, specialist orthopedics services at Stanmore, Moorfields Eye Hospital, and paediatrics at Great Ormond Street, and the Mental Health Trust as well. In terms of our community hospitals, they provide a number of services, including urgent care centres, phlebotomy and physiotherapy. There's also CLCH, Central London Community Healthcare Trust, which incorporates Edgware Community Hospital and Finchley Memorial Hospital. Now, we mentioned at the start that patients are the centre of our focus here at the Training Hub, and therefore, as part of producing this induction programme, we asked a selection of our patients across Barnet what they would like to say to a new member of staff starting work at their practice.
On entry in normal times, I would expect to see a nice, friendly, attentive person with a smile of greeting on their face. Have they got a name tab on their front? If in uniform, is it nice and clean, neat? And if not in uniform, are they actually nicely dressed? Do they look up when I approach, or ignore me and keep me waiting for no apparent reason? Are they talking non-stop to a colleague and not apologising for any delay? For example, sorry, I'll be with you in a moment. The patient could be in severe pain, diagnosed with end-of-life illness, even have lost a spouse. Everyone has their own medical problems, and a smile costs nothing, but can work wonders. There's no excuse whatsoever for being abrupt, rude, cheerless, and uncaring. And that is where you, the professional, can help. Be gentle with your patients. More especially, be tolerant with the elderly. Think of each one as a loved family member. Enjoy your stay with us. Thank you.
The most important thing to remember is that when patients arrive at reception, they're in most cases very nervous. They've got a health issue and it's worrying them. What they need is kindness, sympathy, understanding, and a friendly, reassuring welcome. You might be rushed off your feet and have a waiting room full of patients, but the patient in front of you must always feel at that moment that they are the most important person to you. Accessibility is always vital, and they must be able to reach you. So try, if you can, if there's more than one person at the desk, to always make sure that there is someone who can promptly answer the phone, and that gives you time to speak to the patient. The patient, whether at the surgery, in person or on the telephone, should always be made to feel important, and their issue, however trivial it might appear, is nonetheless of significance to them. Hardly anyone is ever likely to phone or visit the surgery without good cause.
As you walk into the room, into the surgery, somebody gives you a smile, somebody welcomes you. They may not know your name at the minute, but just that eye contact and that smile and that welcome, whew, you feel safe. You feel you come to a place, the anxiety for all of us just decreases, drops, and that's lovely. You know that you're in a safe and a helpful place. Look at the notes before you call the patient in, because then you are truly being welcomed as a person, and that interrelationship with somebody welcoming you, knowing your name, has looked at your notes, feels very safe and is very helpful. I think it must also be helpful for the medical staff, because they're not trying to balance being with the patient and thinking through what the background is and what they've got to offer, how to treat it. And good luck with it. We all rely on it. It's wonderful. Thank you.
Oh, by the way, I do have a postscript for you. Some years ago, there was a popular song called Smile, recorded by Nat King Cole and others. The first two lines say it all. Smile though your heart is aching. Smile even though it's breaking. There, you get the idea. Just keep smiling. Thank you.
The Training Hub has a number of programs and events available to primary care staff that it's worth being aware of. So on the first Wednesday of every month, we hold the Pan Barnet event, which is delivered virtually on Microsoft Teams. And this usually involves a relevant and interesting educational topic. These meetings bring together the wider team in primary care, and there are usually updates from the CCG, the Federation, the Training Hub, sometimes the Medicines Management team. And they're usually very well attended. We have multi-professional attendees. And so we encourage all staff to attend, whether clinical or non-clinical. It's a great way to keep up to date with what's going on in Barnet and hopefully learn about an interesting topic. There are a number of profession-specific programs, such as the GP nursing program, the pharmacy training program. We have careers fairs as part of widening participation. There is a prescription clerk training program and much, much more. And really the best way to find out about all the programs that we offer is to take a look at our website, where you'll find details of all of these programs and more. And it's really important that you do have a fully comprehensive local induction at the practice or practices that you're working at. Now, there are a number of things that should be covered in that local induction. And if you have a look at the induction pack, there's a checklist in there that can be a useful reference for you to make sure that all the most important points have been covered. But a small selection of them are just mentioned here. It's really essential that you are set up early on with smart card access, and that you have your passwords for EMIS and DocMan. It's important that your NHS mail account is active and that you ask your practice manager or practice team to add you to the practice mailing list. I really would encourage you to get to know your team early on, learn everyone's names and roles, and how you can support them, and of course how they can help you. Make sure that you know how to book annual leave and that you book it in plenty of time. Find out who you need to contact if you're off sick, so that any patients who are booked in with you can be rebooked as soon as possible. It is essential that you know where the emergency equipment is, including the defibrillator. Hopefully you'll never have to use it, but emergencies do happen, and so that's an important piece of information to find out early on. I mentioned about the checklist in the induction pack. Keeping up to date with your mandatory training is essential, whether that's through Bluestream or e-learning for health. And for those of you who are required to wear uniforms, just find out exactly what the uniform code is. And as I said, it's really important to get to know your colleagues, and there are an ever increasing range of different roles in primary care, and it can be difficult to keep on top of what all those different roles are. So one of the best ways, if you have time when you first start, is to ask to sit with different colleagues, even if it's just for a few minutes, or just for one patient, just to get an idea of what their role is. You can also look in the induction pack. We've got some information at the end about the different roles, and of course talk to your colleagues and find out what sorts of things they cover, so that you can direct your patients to them, and of course so that they can direct patients appropriately to you. Now, if you're in a role where you require supervision, it's really important that you establish early on who's responsible for you each session, and also to discuss with them how they want to supervise you. So do they want you to pop in whenever you've got a question or after a patient? Do they want you to give them a call? Do they want you to send a screen message? Or if you and they are feeling confident and comfortable, do they want to just have a debrief with you at the end of your session or your clinic to go through any patients that you want to discuss? And for those in clinical roles, it's really important that you have got a number of handy resources. Now, the NCL CCG website is really useful. It's got referral pathways, which can easily be found using the search function, but also has lots of other useful pages, including information about prescribing guidelines. And I really encourage you to familiarize yourself early on with that website so that you can use it to its full potential whenever you need to. Nice clinical knowledge summaries are always a helpful resource for clinical staff, as is GP Notebook. If you are in a prescribing role, then the BNF app is something that's very helpful, and I'm sure a lot of you will have that already downloaded. And be aware of Consultant Connect, which is a relatively new service whereby you can speak directly to a specialist in a number of different specialties and get advice about any clinical queries. And this service is open to all clinicians, not just GPs. So do get registered for that and use it, because it is a very helpful and useful resource. I mentioned earlier about making sure your smart card has the right level of prescribing access if you are in a prescribing role. If you're not yet a prescriber, but you are training towards prescribing, then discuss with your supervisor whether you can be set up so that you can add prescriptions onto the patient's notes and task your supervisor to sign them off if they're happy for you to do so. That's a great way to get to learn and to get familiar with the prescribing process. And for those of you in clinical roles, and indeed those who are non-clinical, it is important that you get involved in all of the meetings within your practice. So find out when your practice meetings are. There will also be clinical meetings where you discuss cases. And there's also a good opportunity to share any learning from projects that you've done. If you've done any audits or quality improvement work, and then practice meetings are a great opportunity to share that learning with the rest of your team. I would really encourage you to make the most of your peers in terms of their knowledge. Now, this could be through WhatsApp groups. Your practice or your PCN, I'm sure, will have WhatsApp groups where you can join and ask, clinical or non-clinical queries and hopefully get quick responses. There may also be some WhatsApp groups for your specific profession, so for pharmacists or nurses across Barnet. The PCN groups are a really great way to get multi-professional advice from your colleagues. And I know that everyone probably has too many WhatsApp groups already, but I would strongly recommend that you sign up to these ones. Now, the Training Hub does have a number of support contacts for different roles. I've listed a few of them here. So for nursing, if you have any problems or you want any advice, please contact Amita Shah. For care coordinators, it's Rafif Mansour. For social prescribers, please contact Caitlin Bays. For reception staff, secretaries and practice managers, please contact Kira Rolat. And for other staff or general inquiries about the Training Hub, please contact our generic address at barnet.cpenadmin@nhs.net. It's important that you're familiar with the IT applications that will help you in your day-to-day role. AccuRx is a very useful piece of software which is directly integrated into EMIS and allows you to send communication to patients that directly then saves that communication into the patient's notes. It's a very useful way of communicating with patients, and it also saves a lot of time due to that integration. If you're not sure how to use AccuRx or not familiar with all of its features, then have a look on the AccuRx website. They've got lots of demonstration videos, and also have a look in the induction pack that has some links to some videos. And just make sure that you're also familiar with how to use DocMan and all of its features, as it's an essential piece of software for communication between general practice and other primary care and secondary care organizations. Now, regarding EMIS training, there is a video on our induction page on the Training Hub website, providing you a general introduction to EMIS. Now, if you would like more detailed EMIS training, then Agnes Ryu at the CCG is very happy to be contacted and to arrange group training sessions or one-on-one sessions. So her contact details are in the induction pack, and she's very happy to be contacted if you would like to arrange further EMIS training. So that concludes this introduction to Barnet Primary Care as part of the induction programme. If you have any questions or you need any further support, then please do contact us. And please do take a look at the other induction videos on our induction page on the Training Hub website. There are recordings of bespoke inductions for a number of different professional roles. And I would encourage you, if you're starting a new role in Barnet, to watch the video most relevant to your role. And finally, I would just like to say thank you for watching this and welcome to Barnet Primary Care. I hope you enjoy your time working here and settle into your role quickly.